So, good evening, everybody, to the last MS Ireland webinar of the year. And I'm delighted to say that our host, as usual, is Trevis L. Gleason. And also delighted to say that our CEO of MS Ireland, Ava Battles, is here as well. Just to let people know, if you have any questions, to put them into the chat section, into the Q&A section below, and not into the chat, into the Q&A, and I'll feed the questions to Travis. And just any questions you have, please put them in and we'll try and get through as many as possible. So without further ado now, I'd like to hand over to Travis.
Thanks, Fergal, and thank you for all that you've done over the last couple of years with the Unspeakable Bits. This isn't one of the Unspeakable Bits webcasts, though I am the host of those. Last year around this time, we did do an Unspeakable with Ava, and also with Dr. Timothy Coetzee, and with the head who's from MS, the National MS Society in America, and then also with Elizabeth, who is the head of the EMSP, the European MS platform. So we decided this year that to do this just with Ava. And Ava, I want to thank you very much for your time on a Tuesday evening in December, as we all ramp up for the Christmas and all that has to do, and then wind down the year, the year at the same time. I suppose to start, Ava, if you're all right with it, I've lived here in Ireland just over 13 years now, and that whole time, you have been the CEO of MS Ireland, to my knowledge, etc. So, I know you in that capacity, but maybe you just kind of introduce yourself to everyone, because this is a worldwide audience, not to make you afraid. A little bit of your background in coming up, and maybe some of the highlights of your tenure thus far.
Yes, I actually have been Chief Executive of MS Ireland now for 14 years, since October. And I suppose a little bit about my background, Trevis, is I trained, I suppose, I initially did a degree in health psychology. So I did a degree in psychology, sorry, and then I did my master's in health psychology. And ever since, I have actually only ever worked in the community and voluntary sector. So that's the space I have, I suppose, worked in since college, and it's the one that I know and love. So I'm 14 years within MS Ireland. Previous to that, I worked with, we'll say, the organisation that people might know, so the Irish Society for the Prevention of Cruelty to Children, Brainwave, the Irish Epilepsy Association, or known as Epilepsy Ireland now, and then Carmichael Centre for Voluntary Groups, which was a shared service facility for 40 small to medium sized voluntary organisations. And then I was lucky enough to take up a role as Chief Executive with MS Ireland. So I suppose for 14 years now, I think MS Ireland allows me an opportunity to bring my background in health psychology, but also that community leadership piece and that management piece into the space that I believe we do, which is improving the lives of people with multiple sclerosis and everything we do. I suppose professionally for me, I get motivated by a role that you can see positive impact for people. That's really important for me. So that's why I love and continue to work in MS Ireland. Also, I suppose the key thing is every day I work with very committed and passionate staff, volunteers, board members, branches, people from all over Ireland. I do feel there's a real sense of community within the community and voluntary sector. And I think over the years, MS Ireland has grown as an organisation. I think we've grown in strength in relation to our strategic direction. I think we've, worked now internationally with, as you've mentioned, the Multiple Sclerosis International Federation, the European Multiple Sclerosis Platform. I think we've adapted very well, in situations like COVID, where, we were all topsy-turvy, and we moved our physio and our exercise programs online. But I also think COVID impacted the voluntary sector and MS Ireland and our volunteers, and how that now is working for us and how people are working on the ground. So there's been a huge difference in that space for us. But I do think we've become more agile. I think we've become more connected. But that's an interesting one, depending on whether you talk to people down the country, versus people who use social media and all that kind of thing. So that's also a very interesting space. But I do think we have become more connected, and I do think we still are very clear on what our core values are, and that we work to those on a daily basis. So I am very proud of MS Ireland and what we do, and the community that we've built.
And so let's go into what would have been the beginning of your 14th year then. This last one, 2025.
Mm.
It's been difficult for the nonprofit volunteer sector in a lot of ways, but I know that there have been some successes as well. So let's take a few minutes and excuse me, no, I'm not getting over this damned cold.
But I can still
Some of
hear
the
it
high
in all
points
fairness,
and
yeah.
low points maybe for MS Ireland as an organization.
Okay. Well, I think the hardest part of every year is saying goodbye to people in our community. I think we have lost many people with MS. We have lost board members, committee members, branch members. I've spoken to branches this year who have lost a number of people throughout the year, and that's very difficult. It's very difficult for people to, I suppose, to work through that. And I suppose I want to acknowledge that their absence is very deeply felt, but also that I believe that we carry them with us in everything that we do. So I think that for me is always a really difficult one, because that's what we're about. We're about people. And I think then, I suppose, as an organization, like many other charities in the sector, sustainability is always a challenge, unfortunately. Making sure that we have enough money to do what it is that we want to do and to resource the services that we're providing. And then access to equitable services across the country. And I'm going to use two examples for that, Trev, in relation to I suppose, the lows of the year. MS Ireland has two business cases on the go at the moment. And so what that means is we're campaigning or advocating for particular things. One of those is a community worker in Sligo Leitrim. So I'm going to do something that's quite local and then look at something maybe that's more national. So for anyone who doesn't know, MS Ireland has 19 community workers. So they're people who work with staff members who work with people on the ground in every county throughout Ireland. So this year we worked with over 2,500 people with MS, received one-to-one casework service. And the number of new referrals for casework is increasing every year on year. So prevalence rates of MS is rising globally, and Ireland is no exception to that. So then, unfortunately for people with MS in Ireland, the only place we don't provide a community work service in Ireland is in Sligo and Leitrim, which makes absolutely no sense in the wider world. And it's estimated based on CSO stats that there are around 300 people living with MS in the Sligo Leitrim area. So we have been campaigning for a community worker in this region now for specifically in the last year. It's a little bit longer than that, but this has been a big campaign for us in the last year. So we would have done, leading up to World MS Day, an event in the Dáil where we had over 40 politicians telling us, of course, this is a vital service and there should be no reason why, people in Sligo Leitrim aren't getting the same service that somebody is down the road in Galway or up the road in Donegal. It's a tiny sum of money. It's about 75 grand. This is not multi-millions. So we'll talk about other projects that are much bigger, but this is a small amount of service to give, a small amount of money, apologies, to give service to people in that region. And we then had an event in Sligo where we had every politician from that region attend, the local politicians. Again, nobody could argue with the findings that we had around why they should have a service there, what the service brings in other regions. But unfortunately, I'm sitting here telling you, we haven't got anywhere with that. Like, I can't sit here and say to you, I'm delighted to be announcing that we have received funding through the Health Service Executive to provide this service to people in Sligo and Leitrim. So that really it's been a tough one, because that day when we were in Sligo, like, we booked a room. The room was packed to capacity. There were people out the doors. People with MS shared their story from the region, really powerful examples of their story and how they are being left without a service and what it would have meant for them and what it would have meant maybe for, it was a person with MS speaking or a loved one. So really that's disheartening, I suppose, is how I would say. And then another, I suppose, low light is our other business case, which is we're seeking funding from the National Service Plan for, basically it's an entire suite of a program to employ a physiotherapist in each HSE CHO area. So what that would mean, Trevis, is we'd be able to offer about 1,500 people to receive group physio classes and about 3,700 people to receive individual appointments per annum. Now, we all know that if you're trying to find physio service in certain parts of the country, you can wait on the primary care waiting list for months, you know.
Right.
And we know how important it is. Like I can quote Susan Coote with the, you know, you don't use it, you lose it. You know, I could give you, we could have a podcast for days on the amount of research that there is on all of the physio programs, the exercise related activity programs, and whichever. There's no, you know, there's no shortage of research here to prove how important this would be. Now, obviously, this is a substantial amount of money. This is nearly 880,000, but shared amongst all the HSE areas, it's around 94,000 per CHO area, where you'd have a senior physiotherapist operating specified classes and programs to benefit people. And now
So I'm
this,
going to stop you there for a second.
yeah.
What is it that those people who are living with MS and people who are dear to people who with MS, what can we do? Who can we call? Whose door can we go and knock on? What TDs should we go to
Like really
their
good question,
clinics?
because that's how, I suppose, how we're trying to do this. And we had a number of people who were willing to become advocates. So people who have gone and attended our physio classes that are put on by MS Ireland, that were willing to become advocates, and they did some training with us so that they could, exactly as you're saying, Trevis, knock on doors, write letters, talk to our politicians and say, this is how this has benefited me. You know, I am now back at work. I am now minding my grandchildren because I'm no longer using the rollator. I'm able to do, I'm back out walking. I'm doing the activator pole class that's now happening in my community because I've done physio and I've benefited from it. So there, I suppose on both of those initiatives it's about campaigning. It's about writing to your politician, asking, sharing it with your local TDs and asking them to support it. That really is. So
And
there,
I think a lot of us have relationships with TDs
oh,
and counselors and all of that. Is there something on the website that
yes.
has a bit of a template?
Yeah, so what I can do is I can also ask Fergal maybe to share after this in the links when we're putting this up on social or whatever, share the links, because we actually have both business cases on the website. We have the
Perfect.
business case for Sligo Leitrim, which is a very succinct document, and we have the business cases for our physio programs on the website. So they're both really, and we can send people out an actual physical copy if you request one. No problem at all. If you actually want to hand, you know, to your local politician in their county council office or whatever, their local office, you can do that as well. So I suppose for us, it's a really good question to me is like, what are we asking people? I suppose we're asking people to share this as well, because I suppose for us, the physio one, it's even more disheartening, if I'm being honest, than the Sligo Leitrim one, because we're doing that now we're kind of beating that drum for a number of years. So they're
Well, and
probably
I
two of the
remember.
ones that have been challenging for us, I suppose, and I mean they're very real for people, because I suppose for me, what people say to us is, you know, what do we want? What services do we want? Physio is pretty much up there as the top service that people are looking for, because they
Well,
want
and you've
something that
you've
they
you've
can
done
do
the work.
themselves.
You put out I think it was a year ago, maybe even 2 years ago now, the economic impact that MS has on every person. Now, by the way, you were well ahead of the curve because that just came out from the National MS Society in America that they've just done that same thing, and it's around 85,000 US per annum per person is the economic impact. I think we're in the 90 something if I remember
No,
correctly.
yes, I think you're right. I think you're right. I
Yeah.
don't know
So, I
off the
mean,
top, but I think you're
that's
right. Yeah.
something that we should be able to say to our politicians, like,
Oh,
look, this will help us stay at home, stay in the workforce, be able to be active members, productive members of society. So this small
absolutely.
investment, let's not wait until things go pear-shaped and then we have to just put more money into a care center or into hospital beds. Let's keep people active as long as possible.
Absolutely. Avoid the hip fractures. Avoid the accident and emergency room. You know, avoid all of these things. We should be looking much more proactively at this stuff. And I think that's where I suppose that then is for me where if you want to jump from that into the highlights. And I don't have one particular one. What I wanted to do was just kind of mention a few things. So if you look at the community work service, 2,500 people receiving one-to-one community work service around the country, mindfulness classes, coffee mornings, information sessions. The respite centre was open in 2025 for the first time in years, full time. The only time it's going to close are the 2 weeks here now over Christmas. So it was open full time, no more closures at the weekends. And we had two young persons weeks in the care centre, which we've never had before. So just encouraging people to come to the care centre and use it as a place where you learn about your MS, and use it as a place where you're trying to do introducing yourself maybe to the mindfulness space, introducing yourself to the fatigue management stuff, but using it in a more positive light, as opposed to sometimes people just see respite as, okay, no, I don't need to do that. Like, that's not for me, that's for somebody else. And we're trying to kind of change that image. And I think the two young people's events were really positive. I mentioned earlier kind of when we were chatting, the MS Sing for Fun group that has started. And they sang for us at the national conference this year at the gala dinner. And it's just an incredible group of people who have come together, who all have MS, and sing. And they use it as that a shared space, the connection, that space where it's really powerful. And also they sing, and they're beautiful, wonderful singers.
Now
Um,
you're moving office to there in the not too distant future as well. So that's going to be another reason that people with multiple sclerosis will be able to attend that space, because it's going to be sort of an MS Ireland hub, if you will.
Yes, so MS Ireland owned a building in Northumberland Road. We are in the process of selling that. And we also have the respite facility, which is over in Bushy Park in Terranure. So the respite facility is the 12-bed respite facility. And right beside that, we had what we used to call it the garage. So what we're doing is we're going to look at redeveloping the garage space, and it's going to become an education hub, whereby, for example, our MS Sing for Fun class can be there. Our yoga class that's maybe happening in the community somewhere else can be run from there. Your physio class, your fatigue management course, your coffee morning. So there's an accessible space for people to come and use. And then upstairs we'll have the staff team, because obviously we're moving out of national office, so we'll have to have somewhere to have as our home. And we'll all be in the one space, which I'm actually quite excited about it, to have the one space which will be their respite education hub space in that region. But also then with that, Trevis, we're going to expand the physio space in the care centre. So that's almost doubling in size, which is where the physios actually now deliver physio to people who are coming to the care centre. We're going to utilise that a lot more in 2026, hopefully. And then we're going to retrofit the care centre as well, like the roof is bad, need of repair. We need new windows and doors and things like that. So we're going to do that as well. So the care centre, hopefully all going well, is going to get a real uplift in 2026. And to do that, we have started what's called a MS Renew project. So it's renewmsireland.ie. So people can go on our website and find anything from, say, obviously we have a corporate that might be willing to give us some money towards the roof repair. We've had some very generous corporates up till now that have helped us in the care centre with the likes of, for example, the bathroom upgrades. So we've had one organisation, Perigo, who have helped us with that. So we're looking for the likes of somebody who maybe is a corporate that would be able to do the roof, or somebody who's an individual who wants to buy the yoga mats for the education hub. So it's a mixture of different initiatives that somebody can get involved in, and that's why we're trying to do that as well in the Dublin space. So we're very
I'll
excited.
ask Fergal if he could put that link up for everybody as well, and that will
Brilliant.
go up when it goes on the socials as well.
Yeah.
Now, one of the things that I was pretty impressed with over the last year, as I've seen a lot more communications coming from MS Ireland about research partnerships that you've been doing around the country, be it having to do with mental health issues or physio, etc. Is it just me seeing it more, or does it seem like there's more of that going on?
No, there is actually. So that's something really good to talk about as well. So from our perspective, I suppose it's worth saying, Trevis, that all the stuff I've mentioned before and up to now is all about service. So MS Ireland is predominantly a service delivery organisation. So we are very different to our sister organisations maybe across the world, in relation to a lot of them would be very much advocacy and research focused, because they often have the services very accessible to them in their own community. And so they don't focus on that. Whereas MS Ireland absolutely focuses on the service piece. But then I suppose what we need to try and do then is make sure that even though that is our focus, we are now trying to work with researchers. We're never going to be doing the level of research or anything like that our international sister organizations are doing. That's not our focus, okay? But what we are doing is we have committed to work with organizations like the All Ireland MS research organization, the AIMS-RN. We're working with Maynooth University. We're working with the University of Limerick. So we're working with different universities that are carrying out pieces of research that are relevant to people with MS, that will assist people with MS. And then what we're trying to do is work with those researchers to ensure they have access to people who want to participate in these studies. And we're doing a lot more in the space of mental health. So we're doing a piece of research. We were successful with the Health Research Board on a project with the University of Maynooth around mental health. So we are trying to do those type of research projects that we feel will absolutely benefit people with MS. But we're not talking about the bigger picture. If you're talking about the bigger picture, you're really talking about the Progressive MS Alliance and the incredible work that they are doing. I mean, that to me is like an absolutely like a global collaboration of MS organizations, researchers, health professionals, people with MS, drug companies, trusts, foundations, everyone coming together to look at the unmet needs of people with progressive MS. And I would absolutely recommend to anybody who's linked with MS, to make sure that they're getting the updates from the Progressive MS Alliance. And we're trying to make sure as well, Trevis, I suppose, that we're trying to share that information as much as we possibly can, so that we're saying, okay, there is pieces of research happening out there. We might be participating in some way in some of those, but we're certainly going to try and share the information that is out there as well with all the other organizations to ensure people with MS have it.
We've got a comment from Paul coming in as well. Also on your social medias on Thursdays, you're putting up the Thursday fundraisers and the Thursday thank yous, I think it is. And that really has been brilliant, because not only are we people with MS seeing what's going on, but those people who are doing it in their organizations, their companies or whatever, they can then share that as well. So you're getting multipliers there that we mightn't have heard about MS and MS Ireland before. So that's a brilliant thing.
Travis, we couldn't function without people, like as Paul's referencing there, like the people we're thanking on Thursdays. Like we couldn't function. So we receive about 65% of our funding from the state. So the community workers that I talked about, for example, okay, we receive money from the Health Service Executive, for example, in Galway to employ a community worker in Galway. So that's what we get money for. But we do not get any money for the physio class that's being put on in that region, the fatigue management course, the booking of the room to put the the paying the physiotherapist to do the program. All of that is done through fundraised income. So when we have the companies, as I mentioned, that come in and help us with the roof, or the person who does the head shave or the skydive, or the runs across Ireland, or actually runs from north to tip top, it's incredible what people do, or the 5K a day for a month, or the marathon. Like, it's just absolutely incredible. Like, at the moment, people are doing the December challenge, and I saw people doing crunches yesterday and dancing in their kitchen on the day before. And it's wonderful. Like you see what everyone does, the dip a day that we did, the readathon that goes on every year, and some of the children. I was in a school there in September, and there was one little girl, and she raised €3,400. This is a little girl.
You just want to hug her, don't you?
This is a little girl in primary school. Like,
Yeah.
I'm just looking at her. I'm standing in front of her going, okay, this is like, it's absolutely incredible. And
I think that's part of what you're talking about is just how community oriented this country is. And that everyone either knows someone who has multiple sclerosis, or they know someone who has multiple sclerosis. And we, as the people with MS, we need to to be a little bit better, I think, about talking about the services that our community needs. Maybe not that we personally need, but that our community needs. So that's a really good point, is that people want to help, and they want to muck in. We need to be a little bit better, I think, at letting them know that, yeah, if you're willing to do a little work, we could use a little bit of help.
And asking. It's
Yeah.
about asking. Like, I mean, all you can do, like, if you ask somebody, all you can say is say no. Do you know? And even if you say no, you just go grand. Sure, that's grand. You know, because people have, and I understand as well. People, you know, obviously there are other conditions that touch people as
Hmm.
well, and they have maybe a charity that is more close to their heart and whichever. People in general are very good. They're so
Yeah.
good, and they commit and they give so much. And I think that's something that blows me away every day in this space, is how good people, like today I was at the MS Care Centre and we had a Christmas lunch, and it is a thank you to people who, you know, maybe have helped out during the year. So the volunteer who comes in and does flower arranging with our residents every week, the volunteer who comes in and goes out in the bus every week, every Tuesday, goes out on the bus trip every Tuesday and assists the driver. The volunteer who comes in and does the entertainment and plays his guitar every Thursday night when they have whichever. The volunteer who comes in and runs a bingo class. And I could keep going. The volunteer who comes in and helps out in the garden. Because we don't have people to do all of these things, because
Hmm.
we don't. Like, do you know, we have our nurse, we have our carers, so, but we don't have all of these additionals. The volunteer who comes in and gives a massage to a person who's there. Like, again, people are incredible. We have volunteers down the country who are running our branches, and spend vast amounts of time every week, you
Yeah.
know, just whether it's raising money or it's actually calling out to somebody or it's just being there. It's been that connection. I mean, it's a
And the
life.
branches are
Or
invaluable to what MS Ireland does. You couldn't
oh,
reach as far as the branches do, definitely.
yeah.
Listen, I value your time immensely, and it's going very quickly, as these things always do. So maybe a couple of final thoughts from you as to what 2026 looks like for MS Ireland.
Well, we mentioned, I suppose, one particular project, which was the big move from
Hmm.
national office over to the care centre, which I think will be big for us and that whole education space. So we're very excited about that and the renew piece. And I suppose there's probably one other one that I would like to mention, which is a project that we're working on in the Midwest, specifically in Limerick. So we were very lucky to receive some funds from the JP McManus Fund, and we have bought a property in the Midwest, and we're going to do that up in 2026. So we're going to have the first accessible gym in Limerick. We're going to have an accessible yoga studio, and we're going to have a facility where somebody can come in and have a one-to-one with their physio or the community worker. So we are so excited about that space. So that's another really exciting project where it's not something we haven't really been involved in kind of that kind of development work before. So we're very excited about that. We're starting our new strategic plan again, which is exciting for us as an organization. But I suppose it is around that. It's about trying to listen to the people we're serving, seeing what's important, seeing what services we should be providing. And I suppose there are two probably of the bigger projects just to mention for 2026.
Those are some pretty big tent poles, and I know that the tent is going to drape far and wide, and you're going to be continue to be very busy as you enter your 15th year. Ava, thank you so very much for your time, for all that you and your staff and all of the volunteers do for those of us who live with multiple sclerosis. I wish you and all of your family the very happiest of Christmas and a joyous New Year. So thank you again for your time. Thank all of you, our listeners and our viewers. We will be back with our irregularly scheduled, well, they're regularly scheduled, but they are irregular in their topics, aren't they? The unspeakable bits probably come February, I think it is. So, on behalf of the Unspeakable Bits, I want to say thank you and a happy Christmas to everyone. And I will kick it over to you, Fergal. Mind yourself all.
Yeah, I just want to mention one question that just came in there from Louise Parr. And she said it's not a question, but just to say a huge thank you to all in MS Ireland for what they do and continue to do. And I would like to just throw that back to Louise Parr because we talked about volunteers and Louise was our MS Readathon
Yeah, can I come in here?
ambassador.
I can't,
Yes.
like, that's a sorry, I know I'm supposed to shut
Yeah.
up now
No,
at
you're
this
right.
point,
No, no.
but I have to say that there you go now. Louise Parr is a perfect example of a volunteer who is our MS Readathon, who has been an advocate in Sligo Leitrim when we were down there, who has talked in the Dáil for us, who has done radio interviews, who speaks so passionately about MS and just is an absolute legend. That's all I have to say. And Travis, if I may end as well with from your point of view, like look at what you do for the community. Look at how much you give with the unspeakable bits and everything else, always being there if we have to kind of ask any chance you'd MC something or any chance you'd whichever, blah blah. So there's that thing where I say you have to ask. And you haven't said no yet. So it is to acknowledge also your role in the MS community in Ireland. But like, and the two of you, for example, for me, are perfect examples of why I continue to do what I do because you make it happen.
You're very kind.
Exactly. Exactly. And Travis, I'd like to thank you as well. We've had a great year. And to let people know that all of those unspeakable bits that you've been hosting all year, they're on our YouTube channel. So MS Ireland, if you just type in MS Ireland YouTube, all the unspeakable bits are there and loads of other different bits of information,
Yeah.
podcasts,
Yeah.
interviews, even the national conference this year. It was over, the whole thing was recorded and there was some amazing talks at that national conference this year.
Mm.
So it is a great resource for people to watch and also to keep an eye on socials. And as usual, we recorded this and it'll be going up after this onto our channels and our next one. Then keep an eye out on social in early January, which is actually quite near, scarily. So keep an eye out for the next ones. And just to thank you again, Ava, for this, and thank you, Travis. Thank you, everybody who's been
Brilliant.
watching and sending in their questions all year. We look forward. Have a lovely Christmas, and we look forward to seeing you all again next year. Take care. Have a lovely Christmas.
Cheers.
Take care.
Take care.
Bye.
Bye.
Bye.